as our numbers continue to rise. So what we are doing is the mildly symptomatic cases, the ones with low clinical acuity, are now going to the step-down facilities once they have been assessed and been put in that category by the clinical staff at the hospitals, quickly into a step-down facility where they can recover in a non-clinical setting, and then of course we wait for the clinical discharge via negative results. So in terms of our facilities we're using thus far, we have at the Brooklyn Sandy Grande facility 20 individuals. At the Balandra facility we now have 31 persons. We have 40 persons at the Tacarigua facility. And we are transferring, as we speak, 60 persons to the Debe Penal UE site, which will give us upwards, in terms of capacity, close to 150 spaces that we can utilize right away for that sort of process. So by way of our quarantine, regular quarantine sites now, we have 183 persons still being quarantined at alternative facilities. These are the Chancellor Hotel, there are 24 persons. At the Cascadia Hotel, 19. There's no one at the Napa this time. Paria Suites, we have 92 persons. If you recall from the US contingent, the Regent Star, we were able to discharge 30-odd persons over yesterday into today, so we now have 20 persons at that facility. Home of Football, we have 28, giving us a total of 183. By way of the general epidemic, as I've discussed before, there are 4 WHO categories. So a country can either have no cases, we have sporadic spread where you have a few cases popping up here and there, can be imported, can be local. Then beyond that we go to cluster phase, which we were a couple weeks ago. We started being in a cluster phase. Yesterday, as the International Health Regulation focal point for Trinidad and Tobago, I made the recommendation to the Pan American Health Organization, who thereafter will make the recommendation to WHO to list Trinidad and Tobago as having community spread. So WHO, once they get that information, they will list it on their website. And when you go to their website, you'll see Trinidad and Tobago now listed as community. Community being different from what we had categorized as local. Community meaning that there are a large number of cases, which are, however, there's a large number of people.
Thank you. To continue the conversation regarding the epidemiology of 2 weeks, surveillance testing, this is expected, and it is actually the purpose for which the community surveillance testing is being conducted, in order to identify and in order to provide a channel for persons to be able to come into the health system, get a test done, and identify whether they have COVID-19 or not. But as that proportion increases, it means that we have a larger group of people, a larger percentage of the population that is showing up with symptoms that are now related to COVID-19 without an easily identifiable or traceable source. Now, with additional epidemiologic investigations, some of these are still linked back to exposures of which the clients were not initially aware. As we get the information on where they have been, where they've exposed themselves to gatherings, etc., we may be able to make certain links between pre-existing clusters and new cases. But the general trend towards additional identification of unlinked persons is the justification for changing that categorization to community level spread. It means that cases are turning up in the community, likely as a result of exposure to persons who they did not know were ill, which then begs the question of where these persons may be circulating and why these persons may be circulating. One of the key messages that we need to emphasize is that persons with mild illness who feel that my illness is mild and therefore I can go about my business need to rethink that position and understand that any mild respiratory symptom, any mild symptom of viral illness at this point should indicate you change your behavior and do one of two things: isolate yourself at home or go to a facility to be tested. If you have less mild symptoms, you start to feel fatigue, you start to feel tightness of the chest, shortness of breath, anything along those lines, then the preference is turn up at a health facility, be tested, and have the rest of the follow-up guided by your test. What we would like to emphasize is the importance of persons with mild illness not attempting to return to work or to continue working in spite of that illness, because this is a recurring feature of some of the cases that we have seen popping up in recent times. While somebody was mildly ill, they were at work for a few days, and then the test turns up that they were COVID positive. Now, epidemics, as we've seen in the pandemic flu of 1918, in this pandemic in other countries, epidemics have different cycles or phases that they go through. The initial phase, where there are very few cases turning up at a given point in time and over an extended period of time, that's called a lag phase. Trinidad has gone through its lag phase, and now it is entering an accelerated phase of transmission, which is called the log phase, and that basically indicates that there's the propensity for rapid numbers of cases to turn up in the population over a short space of time. This is what we're trying to guard against. This is what we're trying to get people to understand there's a risk for, and therefore we're trying to get persons to work with us to prevent the speed of transmission of this virus. The virus is doing what it's expected to do. The virus is doing what it knows to do best, transmit itself from one person to another. The population now needs to do what's expected of it and prevent that by implementing and following the guidelines that we have been harping on, repeating, hammering home from the outset, and now even more so. The need to avoid gathering places, workplaces, etc. when you're ill, the need for hygiene, both personal and sanitization of surfaces, the need to wear masks to prevent the expulsion of droplets. Those things become even more important even as we expand capacity to do testing and as we expand capacity to do clinical management. So with that, the last thing I'll tie up with is just to emphasize that at this point there's no one specific geographic location where the cases are turning up more frequently. As the days go by, we're seeing that across the population centers, east to west, north to south, we are seeing more cases and identifying wider and wider webs of contacts, meaning that there's no place that can be considered exempt and no place where persons should feel they're at a lower risk and therefore can take less precaution. We're advocating that everyone take enhanced precautions, and by enhanced we mean do what you're told to do in the first place. Avoid gatherings, stay home when ill, wash hands, wear masks. That's the enhancement, following the instructions, so that we can help slow the natural progression of this pandemic in the coming weeks. So I'm going to turn it back over to the Prime Minister at this point.
Thank you very much, Dr. Hines. Thank you very much for that clarification. So, ladies and gentlemen, this is where we're at. We have now been reported as having community spread. Now, it means that we do have a significant movement of the virus within the population. And decisions have to be made now to prevent that from accelerating to a situation where the number of sick persons requiring hospitalization or isolation becomes so great that the health system does not have the capacity to deal with it. Now, it is very easy to move from the numbers that we are at now to much, much larger numbers in a very short space of time if we do not seek to push back on the virus now. If you cast your mind back to when we were in the sporadic cases, there were days and sometimes weeks we would have gone and get the odd one or two here. But considering that one person, I think Dr. Hines in our conversation had spoken about one instance where one person would have interacted with 150, 170 people. Now, could you imagine if you have 100 people in that kind of interaction? If you do the maths, you see how quickly our numbers can move from 100 to a couple thousand to tens of thousands. So we really have to respond to that. I keep mentioning to you that people who had missed their intervention timing, in my conversations with them, and I ask, when do you think you would have missed the interaction that ought to have been made? And they would tell me it is about this kind of situation where you think that it's not bad enough to warrant drastic intervention, but in fact, by delaying the intervention in a situation like this, you are guaranteed to move the curve steeply upwards and get to a position where the number of infected persons and the persons requiring hospital care, especially if that hospital care is high intensity care that you're looking for, high dependency unit populations and so. So today, the government has looked at this situation. We've been monitoring it on a daily basis, and we are now at a position where we have to act so as not to get sucked into a situation that is far worse. So there are a number of actions that we will take now, which will be expected to remain in force for the next 28 days. As you may recall, the virus has a 14-day cycle, and we're going to have to watch it out. Those people who are already assumed or known to be infected, they are already in their 14-day cycle. And the people that they've been interacting with, known or unknown, at the end of that 14-day period, such persons would need to have another cycle to be able to say, well, we are shutting out the cycles from running within the population. So as of Monday morning, because tomorrow we'll put the regulations in place, so it comes into force at 6 o'clock on Monday morning, we would have all in-house dining at restaurants and bars to cease from Monday morning, food courts in malls. So what this means is that such places will only supply purchase and take away, no consumption on premises.
Precincts.
Yeah, take away and no consumption in these restaurants and bars and food courts and malls or in the precincts of these places, meaning that we do not want people to gather. So they can provide foodstuff or provide drinks which you will purchase and take away to a non-gathering environment. So that's the first thing we'll do. So we're backing up on that. Beaches and rivers to be closed to the public again for the next 28 days. We also will close all places of worship. So we'll go back to worshiping at home or virtually. We will close all gyms. We will cease all contact sports. Water parks are to close. Casinos and members clubs are to remain closed. Cinemas are to be closed. And the authorized gathering of persons outside of the home is to resort to gatherings of no more than 5 persons. Weddings and funerals and similar sort of events, christenings and whatever, we will resort to 10 persons. Maxi taxis, and we will reduce the availability of travel to Tobago, restricting air and sea bridge transportation and population transportation to essentials. All teaching to close at this point, as though that period of closure for teaching institutions will go until December 31st. And we are consulting with the Attorney General at the moment, and within the next 48 hours or thereabouts, we will indicate what action we will take with respect to the mandatory use of face masks. We are going to find legislative arrangements which will allow action to be taken against those persons in the national population who insist on not wearing a face mask in public, because we are now convinced that they are endangering the wider population, and therefore we will cease to rely on suasion and move to having it become an offense to not be covered nose and mouth in a public place, and that such persons, while we will not be able to pick up everybody or fine everybody, the law will be put in place so that you will be at the discretion of law enforcement to face that. Of course, you can avoid it completely by simply doing what we've been asking you to do for 3 months. We cannot now continue to allow significant proportion of the population to be unmasked when we do know that in managing the virus at this kind of concentration in any population, the wearing of face masks is a useful tool, an effective tool in helping us to restrain the movement of the virus from one person to another. The time for persuasion is now past, and we will take such action. And also, we will ask members of the public, as far as you are able to, stay home. Avoid persons who you have no real need to be in contact with. If you observe what we've done here, we've taken options, but we've left the economy in place. People are still required to go to work. The essential services are on. You'll be allowed to move. But by these actions, all of these actions are aimed at reducing the gathering of people in places where they would normally be exposed to gathering. That is what we're doing now. We've looked at the whole spectrum, and we've determined that these are the actions of the population that creates congregation beyond the level that we are comfortable with, and we've taken them all out. But we've left the rest of the activities to continue, but under strict observation of the protocols as required by the Health Department. And of course, I'm being reminded that we have a commitment, and we'll keep that commitment. On the 20th, for that one day, SCA students will come out and write that exam and go straight back home. So that the SCA exams will still be on, and those children will come out and they'll be spaced out, and we ask parents to get them to school, do the exam, get them back home as quickly as possible. Our children have to remain away from congregations of any kind, and this is apparently going to go on for quite some time. It appears at this stage, given what we are facing now, it appears as though we are more than likely going to have to shut off that first term of the 2021 school year, because by the time we would have gotten over this period, we will still be too exposed, and the risk will still be too high to put children out there into the school space. If the circumstances are such that it is obvious that the children should be out because we have no concentration of the virus, we'd be very happy to be in that situation. But looking down the road for the 12-week period, it appears as though we will not be able to put our children out to school for the rest of the year, which means that we'll have to take significant steps to do home training and virtual school activities as much as we're able to. And the new minister who's going to come into office in a few days, hopefully, that would be one of the first assignments of the new Minister of Education, to ensure that we do have that kind of support there for our school-age population. So basically, we are doing what we have done before, and we expect that if we cooperate with this, and because we have come so far, and because we are so exposed now, we are going to have greater enforcement of the regulations that we're going to put in place, because to have the regulations and not enforce them and allow people to turn a blind eye to them, as some people have done in the last week or two. I mean, we did have a national election, and by and large, most people participated in a way that was responsible. But a fair amount of people behaved with total disregard and abandon. And we are saying that that is what we're going to have to identify and pick out and be firmer. And given how the virus has been behaving in other populations worldwide, these decisions we're taking now at this time in our exposure, we expect that we should be able to control the level of infection in a situation where our parallel system would be able to cope with the numbers of persons who we anticipate would be able to require care. Now, the model, the projections that we are making, which cause us to be doing this, are projections that have certain assumptions, and those assumptions are that certain things will be done and certain actions will be taken, and there will be certain reactions to that. If those actions are not done, then the projections are that the numbers that we are reporting now are going to be minuscule as compared to, and that could happen within a matter of a fortnight. So we really are taking this decision now at this inflection point because we in Trinidad and Tobago believe that this is what we need to do now to avoid what some other people faced by not doing what we are doing now. So if you have any questions, the team is here and we can take them now. The Minister, you have anything to add before the press comes on?
Yeah, I just want to make an appeal to patrons visiting bars. Even though the regulations come into force on Monday, please pretend that they are enforced now. In other words, don't crowd bars tonight and Sunday to take a last drink, because that type of behavior tonight and tomorrow could spiral into an exponential amount of cases 2 weeks from now. So please avoid, just pretend the regulations are in fact enforced from now. And a last word of advice to parents with students doing SEA: take your children to SEA, and right after SEA, take them home. No congregating in the schoolyard, no congregating, well, restaurants and cinemas are going to be closed. That was my fear. Just take your children home and relax them at home. Okay? Thank you.
I know this question is going to come up as to whether people can go out and walk, and the answer is yes, right?
Yes.
But while you're doing that, you distance yourself.
Correct.
You're walking with a partner, keep your 6 foot distance. You're walking with 2 or 3 people, that's your 5, and at all times, be masked. A couple of days ago, as I go around the savannah, I take careful note of who is walking, and initially we had people masking up and walking, and then you see less and less and less people, and you're asking yourself, are these people aware that they should be wearing a mask, or is it that they have come to the conclusion that we are comfortable and we don't have a problem and therefore we can do that? The answer is no, we are not comfortable. And as for those persons who are going around the country defacing walls, writing obscenities, I trust that you will end up in the hands of the police somewhere, advising people that COVID is a hoax and we don't have COVID and all that. That is the lunatic fringe who should be ignored, except when they're defacing walls in and around the city. This is a very serious situation. We have been in this situation since January, and we have been making adjustments as we are required to do, and this is just another situation. Now, let me just say something to the country. If these activities that we are rolling back here now, if they do not get the level of observance as we expect, and the numbers get far worse even after we've done this, the next situation is to go into more complete closure. You would recall when we went to a lockdown, the kinds of cost that was involved from unbudgeted expenses, largely from borrowed money that we used to fund the period of lockdown. The last thing that we want now is to find ourselves in a situation where the prescription for a response that is required is a prescription that tells us that we should go back into a lockdown. But if that is what we have to do to save lives, we will have to do it. But it may not be with the level of comfort and support that we had in the period before, because there are limited resources within the national community. And we have used up significant portions of that during that period of lockdown. So it behoves every one of us to try and avoid that situation where our circumstance in the country as a result of our lack of cooperation puts us back to a situation where the prescription is to shut down the country's activities so as to roll back a level of infection which cannot be treated otherwise. So it is very important that what we're doing now is done to the letter, spirit and letter, so that we don't find ourselves in a situation where our response has to be as drastic as a lockdown. I'm appealing to the population, and I'm asking for some support from those people who are leaders of one kind or another to stop misleading people. And by now, we should be on board, that all of us should be on board in this country fighting this. There's no room for persons to be carrying a separate conversation. The facts are there, the evidence is there, the data is there, and there are two families tonight who I, along with the staff here, extend my deepest condolences to those families who have just lost members in response to the virus. We've lost 10 people in the national population, but we do know that if we do not take this thing seriously, there is a likelihood, not just a possibility, likelihood that many more families, and we don't know who those families are, don't know who they are. Just by cooperating, the life you may save might very well be your own, or somebody who is close to you. There's no room here for picking and choosing. The virus does not pick and choose. It simply wants an opportunity to jump from one person to another. And all of this, inconvenience and losses and pain and suffering, all of this is to minimize the effect of the virus on the population.
We'll start off with the money, just a little bit. Money. Financial assistance for people who, when we had the first lockdown, they received rental and these things. Will that continue? And can we afford to keep that up?
Well, we dealt with most of the applications that were made, and the ministry was dealing with literally cleaning up what we had done. But remember, we're not going into a lockdown now, We're going into reductions. Much of what I talk about here are personal lifestyle things. I said earlier on, the economy continues. So persons will still be going out to work, and what the ministry is doing is just concluding the applications that were there from the lockdown period. We are hoping to avoid a return to that situation where new applications in a situation of lockdown is going to be required, because that is when you're going to have a funding crisis.
Prime Minister, while this is not a total lockdown, we will see some fallout now, and with these restrictions.
Well, if the fallout from this, the Ministry of Social Development will look at it and determine how much support is available to persons who genuinely need it, right?
And with respect to the 50% capacity for maxis and taxis, there was a one-time grant given to those persons, those operators. Will that now continue? Because it would have been a one-time in the first instance, but now with this further restriction.
Well, we'll look at it a little along the way, but I'm not committing to that today. But then we'll, after 28 days or towards the end of that, we will see what kind of assistance that is available. But I simply want to make the point to the national community that there's not a bottomless pit of money to fund back and forth in this matter. If we have to go in there, we are in a much weaker position now financially than we were in in March.
And you would have mentioned the restrictions now for in-house dining at certain institutions, certain places. You've not mentioned pharmacies, groceries, and roadside vendors.
They remain, the businesses remain. Just take it as I've given you. We've taken out this. What we have not mentioned here will continue.
You didn't mention casinos.
Casinos, yes. Casinos, members clubs, and cinemas. We've withdrawn services in those areas.
So financial assistance for those people who work in that sector, will that be
on the table?
Well, that would be on the table as long as we can afford it.
Would they now continue with those workers affected, given that this restriction is going to be in place from Monday? How do those workers now operate? Do they now go back to the Ministry of Social Development? What's gonna be?
Well, they wouldn't come on. They wouldn't. I don't want people rushing on Monday to start to make applications, right? I mean, they either get paid by fortnight or by the month or so. In the coming week or two, we will see how we'll manage that, right? But we will make assistance available as far as we are able to, right?
You mentioned as the Prime Minister, so that one time the exam is on. What about sanitization of these premises, schools, ahead of the exam?
Oh, the arrangements for the essay remain in place. Whatever arrangements was in place for the exam to be done, that remains in place. So we get the exam done and we get the children back home. That's the only day we expect students out.
Dr. Rowley, some people want some clarity when it comes to the reporting of these new cases. Some of these cases are over a period of time. Some persons are wondering if they were holding back the figures.
Okay, so I will take that question, and that's a very good question. So I held a series of meetings with CARPHA, Ministry of Health, Dr. Trotman, Dr. Hines, University of the West Indies. What happened was that with the increased number of testing, CARPHA was in fact turning around their tests in the normal time. So the problem wasn't at the CARPHA end. The problem was that TPHL wasn't able to administer the results. So what I have done from Wednesday, we have taken a lab manager from Insect Vector, put him into TPHL to map the process. In the interim, while I'm waiting for that report, we have put in Dr. Naresh Nandram, whom you all know, directly into TPHL with 2 admin assistants to speed up the reporting. So the problem wasn't the testing, the problem was the reporting of the cases. So from Wednesday, I took those actions, and then we should have a significant impact on that, I am told, by around Tuesday, Wednesday of next week, and hopefully we will have eliminated the backlog by next week, Friday. In the interim, what I have also done in those meetings was significantly enhanced the testing facilities. NCRHA will have their PCR machine up by next week, which will significantly again help with both testing and reporting. What we have also done, I have asked for a new algorithm or a new triage method of how we test, where those results, where those swabs go. So it's going to be based on acuity. Those who need to have results immediately, those who could wait a day or two, those who need results now. So for example, you have somebody in an accident and emergency waiting for an operation. We will now use the GeneXpert machines, which are low volume but much faster, as opposed to the regular PCR, which is high volume but slower. So we have totally revamped the whole testing protocol. So one, the backlog should have significant ease by Tuesday, Wednesday, and then we have significant new protocols for testing. So the problem was never at the CARPHA end, the problem was at the TPHL for the reporting of test results.
If you allow me to go back a little bit to the money, private schools and private preschools, some of the people in charge of these things have not received the grants that they would have applied for, and now some of them are even more anxious.
The grants, when the minister is in place will report to who applied and who didn't apply, because we gave a running commentary on that before, right? There were tens of thousands of people who had applied, and the vast majority of those persons were serviced. There were some still there to be serviced, a smaller number, and that was an ongoing process. So I can't update you on that now. I will leave that for when there's a minister in place, or the minister who is there now, who maybe Monday or Tuesday we can get an update on that. The Minister of Social Development can give us we'll ask for an update on that on Monday, so that you can. But because it's an ongoing thing, there will always be persons who have not yet been served, because it depends on when they came on. The persons who have applied a long time ago, there may be reasons why they have not, because some element of investigative work had to go on. And one of the things that the minister told me a while ago, which I was very disappointed in but not surprised by, was that in managing that system, there were almost 4,000 people who had acted improperly in seeking and obtaining grants. So the fact that somebody is saying I haven't got a grant does not mean that the system is not working. There might be a reason why that particular person hasn't got a grant. But what we've been trying to do is to service all those who, who applied and genuinely qualify and should be serviced. And I was told when I last checked with the minister that the intention was to discharge all the applications that have been made. So, but now that we have come back to this situation, there's going to be some element of continuation there.
What is the situation with daycares? I didn't hear. They remain open.
Daycares were closed.
They remain closed.
You didn't mention barbershops and...
No, they remain open. The barbershops and hairdressers, they remain open. But of course, insisting that because there's personal contact, they must be masked, and all the sanitary arrangements are to be in place. And so far, we can say so far so good. That's one of the areas that we have seen great compliance.
Correct.
The level of compliance in that area has been quite exemplary.
So, what about the public service in particular? Because I know
the public service remains on a 50% rotation.
So it's going to continue.
Yes, managers out to work, managing a rotation of subordinates.
And what about the border closure and the repatriation process? Is that going to be slowed down? Because
will that be cut off now?
Yeah, the minister can give us that had.
The exemption.
Thank you, Prime Minister. As you all were aware, we've been seeing consistently throughout the numbers of persons we grant exemptions and repatriate was dependent on two things: the state quarantine facilities and the state supervised quarantine facilities, as well as we never wanted, if there was a sudden spike, the parallel healthcare system to be overwhelmed. So we are at that point now. You would have heard the CMO give an update that they're now going to be using Debe, as well as Tacarigua and some of these other facilities that we were using as quarantine facilities, as step-down facilities and facilities where those who are mildly affected but positive cases, so it immediately reduces it. We are continuing to manage these measures to make sure our healthcare system can manage the positive cases. So right now we are going to step back a little bit from the grant of exemptions, but we will continue to manage it. We will utilize the space we can in close consultation with the Ministry of Health to make sure that no system is overwhelmed, either the quarantine or the ability to provide the parallel healthcare system.
But there are still people stuck.
Oh yeah, I mean, I had a meeting with the exemption team at the Ministry of National Security, 2 meetings since last week Monday, and one was yesterday, and I was actually quite surprised that some of the numbers have risen. So for example, from Canada, from the UK, because we had done some clearing, we had done flights and granted exemptions, and what it indicated to me, and it was actually confirmed, is that you have people who have been living abroad and they now want to pack up their life there, either in the short term or the long term, and come back. But we will continue to use our priority system, that those who are who went out for vacations and this type of thing, they will be prioritized. The elderly, the sick will be prioritized. Those with small children. So that will continue, but we will have to manage it carefully. So as we've always said, the closure of the borders is to protect the population here in Trinidad, and that is what we will continue to do to make sure our system isn't overwhelmed.
Prime Minister, any thoughts as to cancelling or DCPL? Given the players have been here, they're training, and they remain in that bubble, but...
You may recall that the whole CPL arrangement is that they're operating in an isolated bubble. So they are very well secured away from the population, and that will continue. And even more rigorously, that arrangement is not interacting with the population. It's a separate bubble. The players are among themselves, tested, not interacting with the national population, going to the ground, playing, broadcasting, and that's about it. So that will continue. I think it starts next week. On the 18th, yes.
It's 3 years.
It's on the way.
I have a question for Minister Dialson. Minister, I know that during the previous phase, the planning, the preparation, you would have mentioned bringing on additional personnel to visit places to ensure that they were complying with the washing of hands, installing of sinks, and those sorts of things. Can you say at this juncture, given what we're looking at and legislative changes coming, may we see more persons being brought in to enforce these going forward? Because we've heard the Prime Minister say that persons' non-compliance really is one of the key factors in this spread now.
So thank you, Annalisa. At that time, we did indicate, and I remember distinctly bringing on 50 people. We did bring on actually 48. So those 48 are already there. What we have also done, because this is important, what we have noticed with community spread now, a lot of burden is being placed on the level of the CMOHs, County Medical Officers of Health. There are 8 in Trinidad, 1 in Tobago. We don't want them to burn out. So what we have done, what we decided yesterday at the meeting which I chaired, we are going to be in a very short order boosting each CMOH's office, so like St. George West, St. George East, the River, Victoria, and so on, with personnel to help with contact tracing, doing all the calling, the swarming, the administration. We have already brought on, I gave the instructions already, and have already brought on 25 extra doctors, 50 extra nurses. So we are significantly boosting our capacity at the County Medical Officers of Health. It's a whole biosystem. So we can't have one part working well and another part undermanned and under-resourced. So we have looked at the whole matrix, TPHL, county medical officers, wherever we have noticed bottlenecks and under-resourcing, we have given the instructions to beef them up. And there's a meeting on Monday afternoon at 2 o'clock, which I will be there with all these, somebody will be there, all the chief medical officers to ask them specifically what each one needs. So whilst there are wide categories, each one may need 10 of this, 5 of this, so we are going to flesh out all that on Monday. This was always in contemplation. We are simply rolling out now our backup plans.
I'd like to know from the CMO if you all have traced any of the community cases to any of the political gatherings that took place in the electionary period.
Okay, thank you for the question. It is not possible to trace that number of people in the size of the gatherings that you would have seen on social media, on television, etc., and say with any certainty that any of the cases would have attended those gatherings. When we do ask persons where they had been, what they had been doing, where they had gathered, etc., we get various sorts of answers. I do not recall seeing political gatherings in any of them, but persons are known to withhold information. I will leave that there.
And the wearing of masks in your questioning of people, have you all been able to determine that some of the people who say that they wore the mask consistently got it, or some of those who didn't got it? Have you all been able to determine the efficacy of the mask wearing in your examination of?
That's another excellent question. I like that one quite a lot. The actual feedback that we got from many of the close contact situations, when we did ask about mask wearing, we did find that there was lax compliance with mask wearing in situations where indoor transmission was noted. So this is actually a good point to bring across. The compliance with masks helps to reduce that risk, and we are seeing where lack of compliance does seem to be associated with transmission events.
You said that political rallies were not the answer that you saw on the questionnaires. Could you identify some of the areas that people would have said that they visited?
What people do when you ask them where they went is they tell you they were nowhere. They were at home. They may have gone by a family member. There is a fair amount of reticence when you ask about gatherings and activities. There are subsequent answers, which is why I say the contact tracing is an iterative process. When you continue to have conversations, people, quote unquote, recall having gone to various places, whether it was a religious gathering place, whether it was a bar, whether it was a house party. All of these things come out afterwards. As I said, no one mentioned that they were in any of the particular gatherings, but that doesn't mean they weren't there.
Can you say which place was the number one place that people
home? Most things happen at home because they spend a lot of time there.
If you've ever been to court, you understand the process, right? You start off with great innocence, and then you massage the truth out, and eventually a great canvas is painted. So, but I would be surprised if the gatherings that we've had in the last 2 weeks were not contributing somewhere, because it is the population. There would be no reason why those gatherings would be excluded from any other. Huh?
So, Prime Minister, to follow up on that, with these restrictions, and you saying now that gathering of such during the run-up to the election, do you think that perhaps government may have waited too long to introduce these restrictions, and they should have been introduced prior to the election and during that election?
Well,
because there was a lot of movement.
We could not have introduced this prior to the election, because we were not in this situation when the election was called. The election was called in July, and we were not in this situation. During the election campaign, we started getting some increases, and by and large, the campaign went while there were some people who gathered here and there, but it is not as a result of the election. And if it was, well, at least that is behind us now. And I want to say to you and your colleagues, if I was the first person in this country to have even mentioned the postponement of an election, you would have written so many stories opposing that and accusing me of all kinds of things. And I decided that you will never get the opportunity to do that.
Since your elections?
No, we're not in elections, we are in COVID.
Will we be cancelling like the Independence Day parades and so on?
All gatherings that threaten our safety and security would come under the microscope. As of now, that is not a priority.
I know you would have alluded to it earlier, seeing less people wearing masks over a period of time, but as the economy opened up gradually over the months and the weeks, would you think that a major factor for these high cases that's simply complacency by the population?
I wouldn't say that simply. Lack of compliance is a contributor, but bear in mind that it's a risk. I went into some detail here before. When we came out of the lockdown, we knew that we were exposing ourselves to increased risk, and it is logical if we were away in small groups in your home and we shut ourselves away from the rest of the population, then that situation is not one that is conducive to an explosion of infection. On the other hand, we have to talk about our livelihood. So when we thought it was sufficiently safe, we started working on our livelihood. We opened back our manufacturing, we opened back our transportation system, we even attempted to open back the school. And once you do that, we knew that we were taking on some more risk, but we were trying to manage it, and we started seeing the numbers increasing. And we get to this point now, where we now have to say, listen, we are sufficiently exposed, the level of risk is too great to continue, we need to stop and roll this back by doing what we know will work. And that's what it is. Because all along, we couldn't have stayed home for the next year and say, okay, let's be perfect and have a perfect zero risk situation. It is never going to be zero risk. It's a management of a level of risk. And that's why if it comes out that within a fortnight from the emancipation, from the National Day Parade, that we are in this situation with increasing numbers, or that we see that a population at the savannah of those numbers and the gathering around is a risk that we are going to be exposed to, then we just going to have to shut it down.
I know Minister Young said we sort of slowed down the repatriation process, but the people who want to leave, is that going to continue apace?
The answer is yes. I mean, as the Prime Minister said on numerous times, and as I was repeating even to the staff this morning, anyone who wants to leave Trinidad and Tobago is free to leave. One of the difficulties people have is the modality of leaving, because there's still no commercial flights, but that is something, and I just want to use the opportunity, Prime Minister, to those students who want to leave, because we have anxious parents messaging me. We are going to put on some flights for them to leave, to get to points of transportation, either to the United States, maybe even to Barbados. I'm looking at one to Barbados. But of course, those flights are now going to probably have to return empty at this stage until we can manage to take people into our quarantine system. But we are going to be very careful and bring back as many people as we can as possible, so as to not overwhelm. But whoever wants to leave, is the Prime Minister frequently asks me that, what is going on about people who want to leave? And the answer is yes, everyone who wants to leave is going to be permitted to leave.
Prime Minister, if you'll allow me, please. There are a couple pieces of advice I want to give to the national population, how we need to conduct ourselves. When we say funerals for 10, the same way, that doesn't mean 10 at a time. Because when we had the first set of regulations, funeral homes were allowing groups of people. It is 10 absolute. So it's not 10 and then you move them out and you bring in 10. We need the cooperation of everyone. And what I would like to ask the population, do not encourage gatherings in your own homes for birthday parties, private functions, anniversaries, all these things. These are just as dangerous as being in a bar, because you are inviting people into your home setting. Please, this is a time for voluntary action by the majority of the people to behave very, very responsibly. Do not invite the virus into your home. I have been asked to attend about 10 victory things that people, and I have refused all, because it's dangerous to expose yourselves and your families at this point in time. So just a word of caution. Thank you.
So going back to the CPL issue, my sports department just sent me some questions. They're saying that there are groundsmen and auxiliary personnel, also persons who report to the venue every day from their homes. So they go home to their families and they're possibly exposed to whatever they may pick up or their family members may contract, and because they're outside that security bubble.
Well, so, I trust that the groundsmen are not hogging up the players.
But again, to these drivers, delivery personnel to the hotel themselves may also come into contact, because they're reporting. They're not inside that bubble.
That is precisely why the protocol was that those persons who came in had to be negative before they got here.
CMO could also
CMO,
be specific
yeah,
what
we
how
can talk about it.
I mean, when you look at the fact that
So-
people are living there, they're going home.
Yeah, so part of the protocol means that there's no interaction with the population of Trinidad and Tobago. So there's a complete closure as a biosafety bubble between the players. The players are in. If they have ground staff, for instance, preparing a particular area, they go in, they wear whatever necessary PPE, there's sanitization done, they come out. There's no interaction with the two at the same time. If they have staff, for instance, drivers that are local that have to be continuously interacting, they go into one side or the other of the safety bubble, and that is the way we have created that sort of profile. So the risk that you'll have is persons coming from one side and going to the other side on a daily basis and going back and forth, and that is what we have stopped. So there's no back and forth between two sides of the fence. All right?
And still, while you're up there as well, regarding the two deaths that would have been recorded
Yeah.
yesterday,
Sure.
without divulging, I know patient
Correct.
confidentiality is something that we need to preserve. Can you say how long those persons might have been hospitalized and whether they had been in the high dependence unit, the ICU, when they had come in at what point? You know, had
Sure.
they spent 6 days in hospital before passing?
It's not many days. I think it would be less than about 3 or 4 days in both instances, if you count both instances. Not many days at all. Okay?
What about interviews of players at CPL? Has that been discussed?
So the body for discussing all of that is there's a local organizing committee chaired by Ministry of Sport, I believe. So they have had that conversation that actually came up at one of the meetings, and they will make arrangements for those individuals in terms of interactions with the media, etc. Right? So that has been done through the LOC.
Either Mr. Yasing or the CMO, do we have sufficient testing kits?
Yeah, thank
Are we going to
you.
get more?
So I did order an audit of testing kits on Tuesday, I believe, or Wednesday. The numbers are as follows. Currently, we have 20,360 test kits allocated only for Trinidad and Tobago. On top of that, you have to add what CARFA has for the region. So Trinidad will also be accessing some of the regional kits from CARFA. So that is what we have. In terms of swabs, we currently have 29,000 swabs in the country. And for both swabs and kits, we have more coming in on a rolling basis, on a weekly basis. So we are well stocked with kits and swabs and everything.
Are you aware of allegations that there are people who have tested positive for COVID-19 but remain quarantined at their homes?
So the CMO could address that as he has addressed it before.
So as you know,
There's a chat going
Sure,
on.
yeah. So as you know, there's a regulation that mandates that every COVID test comes to my office directly. The only private lab that we have doing PCR testing is one particular lab. All the reports have been coming. They have actually started to send me up-to-date WhatsApp with their positive results as well. So I'm getting those reports on a continuous basis. Then there shouldn't be anyone that is tested positive outside of our system, outside of the office of the CMO, that we are unaware based on that. So we are asking if there's someone that has been testing outside of that with whatever mechanism, reminding you that there's only one private lab so far that has been authorized, and other tests need to be reported to the office of the CMO, otherwise you fall under that regulation and can be enforced through the TTPS.
But I have seen the social media posts, and I will have Dr. Hines investigate it. You have my word on that.
Let me just say something to him. Look at what is happening. We have a blanket request that if you are sick, if you don't feel well, stay home. That's what we say to the population. I have no doubt that it's possible that a person or persons complying with that request, staying home, could be a COVID patient who stays home because they're not feeling 100%. And until such a person is tested, you don't know that person has COVID. And there's another group of people who will say, well, I think I have COVID, but I don't want to go into the quarantine system. So let me just take it upon yourselves in secret to quarantine at home. That is something that you will not be able to find out unless something else happens that brings you into contact with that person. So it would be, while it would be good to know what everybody is doing, logistically it is not feasible to know that, because a person could stay home thinking that I got a little twitch in my throat, I wonder if I'm coming down with something, and they stay home, and they might even think, well, I wonder if this is COVID. And if it's COVID, let me stay home for 14 days. And then such a person will be outside of the observation of the CMO. So if I tell you that there's nobody who is sick and is not in the system, that is just not feasible.
Yes.
What impact will these new restrictions now have on elective surgeries? What's going to be happening with that?
Good question. So elective surgeries, which we restarted, we have already slowed them down a bit. So elective surgeries are non-emergency, but we are again stratifying elective surgeries, and those that absolutely have to go on will go on. So elective surgeries have not stopped, but we have in fact slowed them down. And what we are trying to do now, to give the surgeons and the nurses as much comfort as possible, we are trying to test these people using the GeneXpert machines. So we are trying to place GeneXpert machines across the system, and I could tell you where they are now. So ERHA will have a GeneXpert machine up next week. So they can do small volume but immediate results next week. TRHA already has their GeneXpert machine, and each RHA will have their GeneXpert machines in short order so that surgeries can go on.
And I'm being asked, Minister, as well,
Sure.
Can you give us clear guidance? Can you give the public clear guidance on the use of a face mask as opposed to a face shield that we're seeing people using? Which one is the preferred choice, and what sort of advice in terms of...
Let the CEO
Yeah, so the face mask is far superior in terms of protection from both yourself being infected as well as you infecting others. The face shield, as you know, there was a particular category of people that may not, for medical reasons, be able to wear a face mask. A face shield provides some level of coverage. It's better than wearing nothing, but it cannot replace a face mask in its entirety.
And I'm not sure who's going to take this other question. Hopefully this will be the last from me. In terms of saying now that we're going to have children remaining at home possibly until the end of December, until the end of the year, what consideration will be given to parents and guardians, persons wanting to bring in electronic devices for children who do not at this time have devices to engage in online learning, to reducing taxes on those electronic devices coming in?
That is a complication which I'm not going to address today, but as we go forward, if those are things that can help and would help, then consideration will be given to all of those kinds of things. But I don't think that we are there at the moment. You may have to wait a little while longer until the counting season is over.
Yes, sir.
Which is the private lab that is conducting the test? I had to confer with my colleague to find out if
The CMO is in charge of that department. I will leave that question for the CMO.
But I mean,
The private lab, I think, would have been advertising all along. I sought some legal advice as to whether the ministry should come out and endorse any particular lab over the next, but I'll leave it up to the private labs to do their continued advertisement. All right?
this GeneXpert machine, how easy it is to import?
Pretty easy. It has become easier within the past month. The initial challenges we had with the GeneXpert machines was that the local agent was out of Guyana, and we did have some initial problems. Luckily, we now have a local agent, and that's why I can say confidently we will have more GeneXpert machines in the country. The GeneXpert machines is a PCR machine. It is just that they are low volume, same accuracy, but you get the turnover in a much faster time because the process is limited. You put the sample into a cassette type thing, it does a lot of the work by itself. So it's low volume, but you get your results faster, as opposed to typical PCR, which is high volume, but it takes a longer time to get your results.
What's the possibility then that a private lab outside of the one that we have importing this machine and conducting tests and giving results without alerting the ministry?
I like your leader.
So the private lab, there's one private lab that actually said to us early on when they were having difficulty for importing that they wanted to use this particular machine. We have looked at their setup. They have the machine, but they couldn't get the kits. So we are waiting them getting the kits, and they can run our test panel, which is supplied by the Caribbean Public Health Agency. Once they can do that, then they may be the second lab that is allowed to offer the test.
So are we at all monitoring the importation of these machines and test kits to prove or to make sure that no one outside of the sanctioned units...
No, anyone can import these kits. There's a process, if you import it as a private lab, to go through before the Ministry of Health would say that we validate your results and say that you are not approved, not certified, but approved to continue. So any lab can import these kits.
But let me just address your question directly. The very first set of regulations that came out, the regulations did have that any private lab must report their results to the chief medical officer. If they don't, both the lab and the individual is subject to a fine of $50,000 and or 6 months imprisonment. So the regulations will take care of, and I'm just going to use the word rogue labs who do not want to conform, and once we find out that, they will fall under the regulations. And it's still in place.
And Minister, you mentioned we are getting a new algorithm in terms of the reporting and results. As soon as that is sorted out, would it be safe to say now by early next week or by mid next week that we should have up-to-date real-time reporting as in cases within the 24-hour and not what we're looking at with 2 or 3 days lagging?
So that is the objective. When I came back into the ministry on Tuesday and Wednesday, when I noticed that, okay, so what we want to do is have like an assembly line. Person, swab, test, results, treatment if necessary. The limiting factor or the bottleneck was not at CARPHA, was not at swabbing. The bottleneck was at the reporting side. So we have strengthened that division as of Thursday, I believe, CMO, when we sent in addition Wednesday, and the new algorithm should reach my desk on Monday, hopefully, and then that will be there. So, as I said earlier, we hope to get that backlog cleared up by middle of next week to the end of next week. In addition, NCRHA's PCR machine, which has a capacity of about 200 tests per day, should come on stream by the end of next week. That will further give us some capacity. Oh, it's up. It's up. The report I had was from yesterday. And then we are also working with Massey. We brought in an Abbott machine, which I spoke about earlier, for Southwest. We did have some initial hiccups with the Abbott machine because of the trade embargo which was in place in the United States a couple of months ago. We got the machine, but we did not get the tests. We eventually got 4,000 tests in. Now the hiccup is that typically you need somebody to fly in to commission the machine. We are now trying to do that virtually, but training for the machine for Southwest is taking place at North Central. So we hope to have all those bits and pieces in place, and then Southwest will have their own PCR machine. Okay?
Can I just ask 2 questions? One, you said the public service will be on the rotation. Is there a recommendation to the private sector in terms of...
No, we are trying, well, wherever the private sector can reduce the exposure of persons, that's fine, because we are wanting to reduce exposures. But we are leaving the economy to continue to operate without what we have extracted here this afternoon. So persons will go to work, and they, in the private sector, they may go to work at home where they're able to, or even do the same rotation if they're able to. All of those things would help, but we are not instructing that.
And has the ability of this old government been hampered in dealing with this crisis?
I'm sure you haven't seen, that means you have not seen the comment of the clerk of the house. That there's no old government. There's a government. If you want to identify the government, you could talk about the pre-countdown government and post-countdown government. The government is in place until such time as a new prime minister is sworn in. But there are some inconveniences, as you would expect. We are not functioning as we were. For example, nobody's generating any cabinet notes. The cabinet did not meet on Thursday. Some ministers have literally retired from politics. The new ministers are to come in. So we are not in a normal situation there. And it will not be normal until a new prime minister is sworn in. The swearing in of a new prime minister is what will give us 100% operation at the level of the cabinet.
Minister Dialsingh, are you still going to work?
I should hope so.
I never stopped working. Even on election day, I was talking to the CMO, and I went back into the ministry as of Wednesday. But even on Tuesday, I was talking to them still. I chaired meetings on Wednesday, Thursday, Friday. Yeah, so I am working still.
Prime Minister, if I may, just one question that we're being asked by quite a number of persons. With respect to the bars, as the Prime Minister indicated, we're not shutting down bars, but there's to be no consumption of what is purchased at bars on the premises or in the precincts. Same thing with restaurants. So it's not the closure of bars, no consumption in precincts or on the premises. Yes, sell over the counter and take away.
That's not, is that practical to go to a bar and buy a drink and go to your car with it?
The alternative is to close the bar door, which we're not doing that.
Yeah, but I have a feeling that people, that will open the door for just the normal bar operation. Yes, because once you're allowed to go in.
Well, if it turns out that day, if that's what's going to happen, well then we just close the bars.
Ministers, we did not mention elderly care facilities, and that is something I know before that had been mentioned in the first instance. But are we going to stick with restrictions for those particular types?
So we have Dr. Rohit Doon, who manages the elderly care facility under our direction. You may recall at an earlier press conference, we did indicate we were rolling back some of the restrictions and starting to allow limited visiting. Even before this current spike, when the spike started to happen, because they are so vulnerable, we rolled that back. And I did speak to Ms. Carolyn Ruiz, who is the president of that association. She is fully on board. So what we are going to be doing now is even, well, there is no more tightening we can do. Visits are now prohibited. Because that is a very vulnerable population. And once you get the virus into a home like that, when you look at the experiences abroad, 40 and 50% of the deaths in certain countries occurred in long-stay homes. Luckily, so far, knock wood, we have not had one, but we want to maintain that vigilance. And I must say, the owners of these homes have been very, very cooperative with us.
With respect to visiting at public institutions such as the hospitals, it was one-on-one, one person.
Yes, we had limited at the start of our response to the pandemic that visiting hours will be restricted to 1 hour, one person, and just like with funerals, it lapsed, and then you got one person going up, coming down, and another person, and we stopped that. So the same way we are asking funeral homes and hospitals, it is one person per visit. Same thing with funerals. It is 10 people, not 10 people in a group at a time. We need the cooperation from all sectors of the society. But thank you for asking.
Prime Minister, there are thousands of questions coming in here.
Yeah, is there any other question from here? Any other question from here? And then we round that up.
Election question. No, not election question. You mentioned that you're going back to the PG regarding mandatory mask wearing and these things. What about pandemic leave? Are we still looking at that outside of the public service?
There is something that went out, which I think the minister can explain, but that's as far as it goes. The pandemic leave in the public services is to stay home when you get paid for staying home. That's as pandemic as it gets.
So what the cabinet decided was there is now COVID-19 pandemic leave that ceased on the 21st of June. So public servants between the date we first put the regulations, I believe it was the 12th of March to the 21st of June. During that period, the public service now has that you were permitted to stay at home and be paid. And that's called COVID-19 pandemic leave. What the Prime Minister has outlined here does not affect the continuation of that. And then we also allowed for public servants who are outside and couldn't get back in awaiting exemptions. They can also be caught by that category. But that is for the public service, and it is merely a recommendation to the private sector.
Okay, thank you very much. Thank you very much, and I trust that when we meet again, we hopefully report improved circumstances. If the circumstances are not improved, well then we know that we can't ignore, we have to respond. Thank you very much.
The Kirab Pentecostal Empowerment Ministries International of 27 McDonald Street, Kirab, Trinidad, West Indies presents Empowerment Through the Word. Come with us as we affect humanity with the life-transforming power of the gospel of Jesus Christ. We invite you to stay tuned and be blessed.